Your client has a potassium of 5.7. What could be causing it? First off, identify that 5.7 is hyperkalemia. On the NGN, you're going to see those normal reference ranges, so don't sweat it. It's a select all that applies, so let's take this one answer choice at a time. Could Cushing's disease cause elevated potassium? Nope, Cushing's disease will cause a loss of potassium leading to hypokalemia. Incorrect. Next, what about nasogastric suctioning? Also incorrect. With an NG tube, we'll be sucking out that potassium, also leading to low potassium levels. Next, we have salt substitutes. This is correct. To substitute sodium, we use potassium, and we eat too much of that, we can have hyperkalemia. How about D, hyperinsulinemia? Well, no. Remember, insulin actually opens the door for glucose to go inside the cell, and potassium likes to hitch a ride and go inside with it. So hyperinsulinemia, that leads to a decreased potassium level as well, not an increase like we see in this client. Lastly, E, adrenal insufficiency. That means we don't have enough aldosterone. Low aldosterone, and we will retain potassium. So E is correct. High potassium, hyperkalemia. We can actually use one of our testing strategies here. Adrenal insufficiency is the opposite of Cushing's disease, right? In Cushing's disease, the adrenal glands are producing too much aldosterone. And of course, in adrenal insufficiency, they're not producing enough. So we see the opposite effects on potassium levels, and we know that opposites attract. So in these answer choices, one of them is going to be correct. They can't both be correct because the opposite things are happening. For more testing strategies like these, join us over at archerreview.com.